Hi, my name is Dr. Avalos, and I'm here with Sunbrite Dental. And a lot of questions that I get regarding making my patients' teeth look better often deal with teeth whitening, veneers, what's the difference between the two. So today I'm just going to go over the most common questions that I get about cosmetic dentistry and if it's the right choice for you. A question that I often get are, Doc, what are veneers? And I can explain it best to women because the best example I can get are like those fake nails that are pre-painted that you often see at the drugstore, right? And you take them out of the package and then they are glued onto the top of your nails. And then voila, you get an instant French manicure or whatever design or color that the woman has picked for herself. So veneers are exactly like that. They're made out of a thin shell of porcelain, and we can make it whatever color the patient decides. Often, patients always like to make their teeth whiter and brighter, so we can make it whiter than their natural teeth. And then the thickness is about the thickness of a credit card. And then we can alter the shape and size of patient's teeth so that it's more proportional to their face. I had one patient, she has a beautiful smile, but in her own words, she told me, Dr. Abelos, I feel like I'm a grown ass woman with little itty bitty girly teeth. And I told her, we can have your teeth proportionate to your woman size by doing veneers. You can check out her before and afters on our website. So we can change the shape. We can also just change the color, or we could do both. It just depends on what the patient tells me that they're looking for to change and improve with their smile. The other question that I get is, how about teeth whitening? And so here you have two options. You have the slow go at it, which you can achieve with our take-home trays. And our take-home trays comes in a box, and there's 10 sets of top and bottom trays that you can wear. I use those and I whiten my teeth because I drink coffee 3 times a day. Busy mom, dentist. And I can't show up greeting my patients with yellow teeth. So I whiten my teeth. I use that not to whiten, but it's more to make sure the stains from the coffee that I drink every day don't settle in. So you can use it that way, or you can use it one tray every day for 14 days to get a more drastic difference. That is the slow way you can do it. If you want something more instant, we have laser whitening that is offered in the office, and we use a gel light cure system. Our hygienist stays with you throughout the whole appointment. I get that done for myself maybe once every other year. This is like a deep stain lift for my teeth, again, because I am a coffee drinker and I love it because the hygienist stays with me. They don't leave me alone with the machine that's just shining light on my teeth. The hygienist is there with me throughout the whole process, and she's looking to see which teeth are whitening faster than others, and that way she can concentrate the gel and the light on the more stubborn stains. And for me, again, because I'm a coffee drinker, that's usually my bottom teeth. And so that procedure takes about an hour. And then, according to what the hygienist sees, then she might have the patient come back for a touch-up that is included with the procedure. Then the next question that I get, or a lot of patients come in and say, "Doc, I just want a smile makeover." And that is the biggest range. That includes a lot of the dental treatment that we have here. If a patient has a big space, missing some back teeth, or they find that all of a sudden their front teeth are cracking, chipping, and breaking, we often take our time to not only address the symptoms of the problem, and that would be typically what the patient is coming in for. That is what the patient notices about their teeth. They're either chipping, breaking, they're missing. But the other thing we like to do here is figure out the cause of the problem. Because we can fix the problems, fix the symptoms all day long. But if we don't really look at the cause, what's causing the patient to have missing teeth, or what's causing the patient to have cracking teeth, or what is causing them to yellow, then we're going to have to deal with that same problem again. And the patient in the future may be in the same situation of feeling the need to do a huge haul over with their teeth and their smile. That is not what we want for our patients. We just want to make sure we fix the symptoms that has brought them in for, figure out what caused the patient to be in that situation in the first place so that they're not in that situation again, and then they can have beautiful teeth and a long-lasting smile, and then we're just here to help maintain that. The other question that I get is, how do I choose the right cosmetic dentist? And there's a few things, but the main thing that I tell the patients is make sure you find a dentist and a dental office that you feel comfortable going to and seeing, because oftentimes, aside from teeth whitening, that's only one appointment. Oftentimes, veneers or smile makeovers, they are multiple appointments. And so you want to make sure you find a dentist that you feel like you can have open communication with. Because if there's something that you don't like about the temporaries, here at Sunbrite Dental, the temporaries that we give the patient gives them a really good idea of what the size and shape of their new teeth are going to look like. It's like the try-on period, right? And I invite our patients to let us know whatever may be running through their head. I've had one patient say, I know I asked for bigger teeth, but doc, while I was driving, it just bugged the crap out of me when I felt the edge of my tooth hitting the bottom of my lip. Am I going crazy? And I told my patient, no, you're not. You're not crazy. It's just whatever feels comfortable for you. And so I want to make sure whatever we do to improve your smile, it's not what I want for you. It's what you want and what you imagined for yourself. So I told her, come in, let's do some adjustments. And when we're doing adjustments, we oftentimes have the patient hold the mirror while we're doing the adjustment, and we're communicating together. Is this what you like? Is this what makes you happier? Because there's nothing worse than buyer's remorse, or just sitting there feeling like you have to end up with something that you completely did not imagine. So that's number one. I feel like make sure you feel good about the dentist that you've chosen, and you feel like you can openly communicate with the dentist. And then the next one is make sure that it's a dentist that has done aesthetic cases that you're trying to achieve. So here we always like to, based on what the patient tells me, I will show them similar cases that we've done, and I can show you our before and after photos, because you want someone, especially with more difficult cases, or if we're doing almost all the teeth in the mouth, you want someone with more experience, or someone that has gone to continuing education courses and that is staying up to date with new modern technology so that they can give you the exact smile that you imagine for yourself. There's nothing worse than what I call chiclet teeth. There's a lot of questions that I get, like, what's the difference between a veneer and a crown? And so a veneer, the best way I can put it would be a shield that is cemented on top of your natural teeth, right? I have two boys, so I think Marvel. It's like a shield, Captain America's shield, like it's glued on to the top of your natural teeth. A crown is more like a helmet, like it full on covers the full tooth. So a veneer is more like a shield. It's not it doesn't protect the whole body, whereas a crown is more like a helmet. It goes over the whole tooth and it gives more protection. I hope this video was very helpful in answering your questions regarding cosmetic dentistry. If you have any more questions, please feel free to set up a consultation with me. My name is Dr. Avalos. I'm here with Sunbrite Dental, and you can reach me at 702-459-0303. Thank you.